So the idea of our conversation is to like shortly show you how we use in general the basic knowledge in our daily practice. My name is Gosia, I'm in my pediatric residency, and this is Živa.
Yes, I started my pathology residency last year.
And so we were participating in building the learning unit about basic knowledge. So we came to the idea that we use this knowledge daily, right, in our practices, not necessarily maybe, like generally speaking, in clinical practice daily, but we would like to give you some kind of examples. When do we need it and how do we use it when we come back to this knowledge?
Yes, because very often it seems as we start learning anatomy or biophysics or biochemistry, it feels like it's totally unrelated to what are we going to do as medical professionals.
Yes.
And sometimes even years pass before we circle back to it, when we start working with patients, and then we circle back and realize that we very much need the anatomy, that biochemistry can help us better understand pharmacology. I believe it's not my personal example, but I believe that every surgeon needs to really be good in anatomy in order to be able to perform surgery. So whenever you're going to choose a surgical residency, you're going to have to circle back to learning anatomy of a certain organ system really well in order to be a great surgeon.
Like, considering anatomy, even in your daily practice, ultrasound using, it's a kind of thing that like comes immediately to my mind when I'm thinking about anatomy lessons. It's absolutely useful to have this knowledge in order to assess the organs, assess where should everything exist in your ultrasound examination afterwards.
One way to maybe make your learning more meaningful is also when you're gonna start learning pathophysiology during your med school, for example, it's gonna be very abstract. You're gonna have to be learning about different pathological processes that you won't be really able to imagine in real life. And then you go to your clinical rotation and you encounter a patient, for example, with a myocardial infarction. And this is a perfect time where you can go back and revise the pathophysiology of the condition. It will help you understand it better. It will help you remember it better. It will help you understand the clinical picture that the patient presented with. And therefore you will have something more meaningful to use that knowledge. And you will, whenever you will encounter a new clinical problem, a new patient, you can always circle back to basic knowledge to really understand what it is that you are doing in your clinical practice. And next time you will be way more confident, because not only will you understand what's happening in a clinical setting, but you will actually understand what's happening with a patient.
And to be honest, it will be useful for the rest of your life, for the rest of your clinical practice, because each time you are, for example, explaining your patient something that is going on with him, you're coming back to your like basic knowledge, right? You're explaining the physiological processes that are disturbed by something. You're explaining how the medication works by using your pharmacology or even biochemistry knowledge. So it's like daily crucial knowledge that you need to use.
Yeah, and maybe my take-home message for you will be, if you're struggling now learning basic science, know that maybe it won't even make sense for a couple of years, but it will eventually become very useful and it will help you see the big picture. And it's a necessary step that we all had to take, and it had some important consequence for our future career. So stick to it, even if it's maybe a little challenging for you at the moment, because it's really gonna start making sense in the future.
And consider not selling your pathophysiology books at the very end. Thank you very much.